This has been a day we've been waiting for a really long time.
The Lehigh Valley Health Network cut the ribbon on its new state-of-the-art Cancer Center at Lehigh Valley Hospital, Hazleton. It's part of the Lehigh Valley Topper Cancer Institute. Dr. Brian Nestor, president and CEO of Lehigh Valley Health Network, says the new 32,000 square foot, $20 million facility brings the next level of care to Hazleton.
We came together with the Hazleton community back in 2014 and had a vision for expanding our cancer services back down in Allentown up to where people live. And we started a practice about 6 years ago, which was within 6 months completely filled. We didn't have enough chairs for infusion, for chemotherapy, and we set about building a centralized cancer services facility, state-of-the-art, where we could bring all services here, radiation oncology and chemotherapy and other new immunotherapies that are only available usually in metropolitan areas. But we're fortunate in terms of our arrangement we have as one of the 3 members of the Cancer Alliance for Memorial Sloan Kettering, that we were able to bring all of those clinical trials and the best of all the cancer services we have at our home site down in Allentown and bring it right here to this facility. We're psyched because when people go through cancer, they need their family nearby to help them.
This is a dream come true for so many patients in the Hazleton area, for all of us that have been here the last 9 years building towards this. Dr. Mike Evans, Dr. Hotchner, Dr. Karp have all been practicing in this community. Now we're able to bring all of Topper Cancer Institute resources because we have a beautiful building with brand new radiation facilities, radiation that has stereotactic radiation capabilities, just like we have in Allentown at Cedar Crest. We can also bring our Memorial Sloan Kettering Cancer Alliance here, which includes clinical trials, standards of care, counseling, social work, navigation. So it's huge for the community.
What made this event even more special is that one woman who is taking part in a cancer clinical trial had the opportunity to help cut the ribbon.
Quería estar aquí por agradecimiento, porque las personas que están trabajando conmigo son ángeles en la tierra.
She is here because she is so very grateful for everything that has been done for her. She feels like they're angels on earth, and she just want to pay that gratitude, to acknowledge what they've done for her.
What does she think of this new facility?
¿Qué piensa de este centro?
Maravilloso, maravilloso que las personas que viven aquí ya no hay excusa para acudir a un buen hospital, con un equipo que yo se lo recomiendo por experiencia vivida.
She is so grateful to have it right here on campus. She highly recommends this campus, and there is no reason for anyone that is suffering with cancer to go any further because you have the experts here. She really believes and has total faith in what these doctors have done for her here.
And for you, Dr. Torres, what does this mean for this community? Because I know you're very proud to be at the helm of this facility.
I am overjoyed, especially today, with having this open on this campus to be able to treat our community of all different types of cancers. You couldn't have asked for a better team. These doctors here have studied in the renowned hospitals, and here they are today providing the service here close to home.
What will this mean for a patient that is coming here? How will things change now?
I look at the Topper Cancer Institute as offering very personalized cancer care. That's both the TLC and compassion with navigation, but also finding out about the genes that are driving their cancer. That's how Sloan Kettering attacks cancer, and that's how we've been attacking cancer the last 7 years. We do universal profiling and look at mutations, look at clinical trials, and work as a team with multidisciplinary cancer specialists that are specializing in various cancers. And in areas like stage 3 melanoma, we've shown that our survival is 20% higher than the national. And so we can bring that up-to-date early treatments right here to the community.
For years I've heard the name Sloan Kettering, and I remember even as a kid growing up hearing about, Sloan Kettering Hospital. What does that name bring? What does that mean? What is it synonymous with?
So Sloan Kettering is excellence in cancer care. It's a cancer-only research hospital. They have 2,000 oncologists that are specializing in every type of cancer. And we have 50 oncologists in the Topper Cancer Institute, and we have 4 oncologists here locally that are able to deliver the care using all the help from Sloan and all their resources.
What would you want the neighbors to know that when they come here, that what they're going to find that maybe they didn't find before?
They're going to be treated by their local compassionate care colleagues, but they're going to be supported by a large group from the Topper Cancer Institute and also backed up by 2,000 oncologists at Sloan Kettering. So it's kind of bringing personalized care right to where patients live and trying to get the best outcomes possible. Every family has had someone go through cancer. My own sister's going through cancer treatment right now in New Jersey. And what you want at the end of the day is peace of mind that everything that can be done in 2023 can be done. And when you're able to deliver that care right close to home so patients aren't doing the 1 hour plus drive to Allentown, that means the world.
Is there anything I didn't ask that you feel is vital to this?
I think the community support that's been very evident is very big part of what makes today so exciting. You can see it's a celebration here today.
This will save a lot of trips to different locales. Even if they were local, you don't have to travel to 3 different buildings. You don't have to go to any other community. Everything is under one roof. So explain how that works.
Well, it's an integrated care delivery model that has, with the advances in cancer care, allowed for all of those services to be seamlessly integrated into one building. Much of the technology in radiation oncology has become smaller over time, so that can be now adjacent to advanced infusion therapies. And having all of the doctors in different disciplines, whether it's a blood disorder, or solid tumor, or it's a radiation oncologist, to have them all under one roof, working with each other every day, moving patients to and from different aspects of cancer care, it's priceless.
You had a special woman come up here to cut the ribbon today. What did that mean?
It's everything. It chokes you up.
It did.
Yeah, because it's about people. I hope you can sense how psyched we are to open this facility. This is a big deal for our organization, Lehigh Valley Health Network, to finally be able to deliver these comprehensive services to Hazleton and the region.
Personalized cancer care has always been available here in the greater Hazleton area, but now it's available at a brand new state-of-the-art building with all the services under one roof. Let's check it out. Welcome to the Lehigh Valley Topper Cancer Institute in Hazleton. This $20 million facility once housed a former nursing school. It now offers state-of-the-art cancer treatments, technologies, and clinical trials right in your own backyard.
Right now we're in our CT simulation room. So this is where when a patient comes to radiation oncology, they come here before they get their radiation treatment. And so we take a scan of them, we set them up in their treatment position, and kind of get their baseline images that we will use for treatment when we treat them on our linear accelerator across the hall.
Can't help but notice what's above you. That's rather unique.
Yes, it is. It is. Our patients come and sit on the CT for about an hour, and so we wanted to have a little bit of something above them to sort of distract them from what they're going through. So it is very beautiful.
How excited are you about this?
Oh, so excited. It's been a long time coming, and I'm really glad that we're finally opening. So I'm very excited to be able to bring this kind of technology to the Hazleton region.
This next feature is the centerpiece of this facility.
So behind me, this is a variant TrueBeam linear accelerator. So it generates radiation to treat the cancer within our patients. So the whole machine circles around patients, delivering treatment at various angles. It includes imaging on either side so that we can take what we did in the CT room across the hall and translate it to this room so that we can pinpoint exactly where the patient needs their treatment.
Having a brand new state-of-the-art linear accelerator means that the precision of the radiation delivered goes up. So much less worry about side effects to adjacent normal tissue, much more on-target treatment of cancer.
When they were speaking here today, they talked about how the numbers have increased. Tell us how, unfortunately, the number of cancer cases has grown, and you expect it to be even more.
Yeah, no, the rate of cancer has been high in this region. Part of it has to do with the age of the population in the Hazleton area. A lot of it, optimistically, has to do with our treatments getting better and better, because even if cancer is occurring at the same rate, if we're treating cancer better and people are surviving and living longer and longer, the prevalence of cancer goes up. And so that's a lot of what we're seeing. We're getting better at treating cancer, so there's more cancer patients who are out there doing well and continuing to receive treatment.
What advice would you have for our viewers about cancer treatment now in the Hazleton area?
Well, at this point, I would say, I love second opinions. Anybody who comes to see me, I think thinking about where you want to get your care and seeing what your options are will continue to be important things for people to do. But I want everybody to know that we can offer 95% of what they need right here in this building. And the way that I practice and the way that my colleagues practice, if it's something that we can't offer here in this building, we will tell you. We don't want to hide that from you. So if you need to go outside of Hazleton for your treatment, we'll let you know, but we'll do everything we can to get you treated with state-of-the-art treatment here in Hazleton.
Continuing along with our tour of the building.
Right now we are in our infusion area. This is where our nurses provide chemotherapy treatments. We also do blood transfusions. We provide iron and any other antibiotics, hydrations, anything that the community would need for IV services.
I would assume that this gets used frequently.
Yes, our current site we outgrew probably a year ago. We can see anywhere from 25 to 35 patients a day. Our nurses are biochemo certified, and within 3 years they have to receive their national certification in oncology, which several of them already have.
Now, you've been doing these services in the area, but now in this state-of-the-art facility will make it much better.
Yes, they have nice private rooms, makes it easier to have conversations. If you're sick, you don't feel as well. We can provide you with a private room. We have 2 beds. We have lifts now, ceiling lifts, to make it easier for patients who can't walk. We have heated and massage chairs for the patients who are here, 6 hours. It makes it a little more comfortable for them.
Have the patients been looking forward to this?
Absolutely. They are so excited to be moving into the new site. Some of them will even be coming through today.
What goes through your mind? What are you most impressed about with this?
I think it's beautiful. It'll be wonderful for the patients. We have radiation on site, we have infusion, and we have medical oncology. They don't have to travel. They don't have to, go from site to site. It's all right here for them.
In addition to on-site state-of-the-art services, there is also now expanded telemedicine services.
We are in the telemedicine room. This is where our doctors can come and we can put patients on tumor boards at Cedar Crest, and we can get input from various physicians and providers within the Cancer Institute. We also would do our multidisciplinary clinics here. This is where a patient would come and they could meet with their medical oncologist, their radiation oncologist, surgical oncologist, the navigator, and get their plans started at the beginning of their treatments. So this is new for us here, but it'll make care seamless, and it just adds extra for the patients.